Getting the homeless vaccinated should be a priority. One of society's most transient groups, exposed to COVID in crowded shelters and at risk of complications if infected. Charities are reaching out.
They often have no medical support at all. Some are in poor health. Many haven't seen a doctor for years.
Increasingly mobile in the summer, the homeless need the support of Europe's cities now more than ever. Welcome, I'm Ben Fazulin. Well, that support varies from city to city, as we'll discuss soon, and it's access to vaccines that's often the hurdle for the homeless. But as our reporter Juri Rescheto found out, an initiative in Saint Petersberg is reaching out to those living on the streets.
Witjok knows this street well. He's homeless and prefers not to give his full name. Every morning he comes here to 7 Mirgorodskaya Street behind the beautiful facades in the center of Saint Petersburg. Hot meals are served here daily. Today, Witjok and his 30 or so friends from the street are also getting their first dose of Sputnik V, Russia's vaccine against COVID-19. There is a small gift too, some hygiene items to take away as a thank you.
The gift will eventually run out, but the vaccination will stay.
A local charity organized the vaccination drive with a couple of Saint Petersburg doctors. They say it's long overdue. An estimated 60,000 people live on the streets of Saint Petersburg, a city of 5 million where the coronavirus is spreading fast. Nearly 2,000 new cases are registered here daily. That's the second highest rate in Russia after Moscow.
Homeless people are just normal patients who also get sick and get COVID-19.
But what makes homeless people different from others is that they often don't have papers and can't identify themselves. And in Russia, just like everywhere else, a COVID-19 vaccination has to be officially registered. So volunteers are helping to establish the patient's identity.
Maria Alexeyeva, your consent form.
But it doesn't work for all of them. Some don't even know their names. Still, the helpers say this shouldn't stop people getting vaccinated.
The situation with COVID-19 means that everyone in Russia needs to get vaccinated, regardless of whether they have their IDs with them right now or not.
It all takes a couple of hours. The vaccination is voluntary, the mood relaxed.
It's good for me and means I won't infect the others.
I've already had my vaccination. I've had all the vaccinations. I'm just here to get something to eat.
Today's lunch is mashed potatoes and a piece of white bread.
Here you go. Bon appetit.
We chose this place because people come here for food anyway, so we didn't have to give them advance notice about the vaccination.
Witjok, meanwhile, has also gotten his lunch. He's been living on the streets for 3 years and says he's happy. In exactly 21 days' time, Witjok and the others will get their second dose of Sputnik V. They already know exactly where to come.
So, should the homeless be prioritized? Let's talk about that with epidemiologist Thomas Roderer. He joins us from Paris. Where should the homeless be placed on vaccine priority lists, in your opinion?
Hello, thanks for inviting me. That's a tricky question. If you, in terms of numbers of potential cases, etc., maybe the homeless people are not the highest priority for a nation or for a government. But in terms of sheltering, of protecting the most vulnerable people, they should be as high as the elderly people, etc. To my opinion. That's just to avoid having a high fatality or high number of cases in this population.
Exactly. According to some doctors, I've read that homeless people with COVID are 5 times more likely to be admitted to intensive care units and 8 times more likely to die.
Exactly. In a recent systematic review and or meta-analysis, I think it was published in eClinical Medicine, that was really summarizing all the studies and all the reports that have been done on homeless population, COVID-19 impact on the homeless people. Yes, even though I have to nuance this a bit because there has not been that many studies, so it still needs to be studied more. But yes, they have more risk of having hospitalization, and they are more at risk of dying. Because of several factors.
I guess.
For example,
Sorry. Go through those factors for me. That's something important that people should know.
Yes. So, for the people who are not super aware of the conditions of living of the homeless, so you can have people living in the streets, but you can have also people sharing shelters, having to go from one place to another. So in terms of COVID, or in terms of epidemic-wise, they are more at risk than the rest of the population because they have to go find their own food. They have to go in several places to find food, to find accommodation, etc. So they are exposing themselves just by having to go around. And also they have more comorbidities in general. Depending if they are recent migrants or if they are homeless living in the streets for a long time, they can have also several diseases linked to age. They can have diabetes, hypertension, high blood pressure, etc. So they are a bit more. I don't know if we can say a lot more, but a bit more at risk than the rest of the population.
And Thomas, age mostly determines where you are on vaccine lists, but homeless people in their 30s, 40s, 50s often have health problems typically found in much older people, don't they?
Yes, you can find some diseases such as diabetes, for example, in a 30 or 40 years old living in the street. So, indeed, the age criteria shouldn't be the only one to decide who to vaccinate. And I don't know for other countries, but in France, it's not the only criteria. It's also the risk factors that should be also studied. Even though it hasn't been really a criteria that has been super well followed in France, for example, age was really the main factor, the main criteria to get vaccinated. So for homeless people, it's a double burden. They are not a priority in general as homeless people, and also they tend to be a bit younger and so not fit the criteria to get a vaccine. Even though it's changing, of course.
For France, it doesn't seem like they're a priority either in this pandemic. Where you are, the homeless are in the 4th or 5th phase of the rollout. In other countries, like Hungary, for example, they're in the 2nd phase. Why is the picture so mixed in Europe?
I think it has to do with the several things, politics, of course, but it's also you have to do choices, and also it's one thing to say I would like to see the reality for Hungary or Russia, for example, like in your documentary. You have to find the people who want to go to vaccinate and how to vaccinate homeless people and migrants. In France, it has been a challenge. The authorities they decided to change the priority for homeless people, but they didn't have the capacity to go and find and convince homeless people to get vaccinated. So in the end, they had to rely on NGOs and organizations to do the work for them. I don't know how it is for other countries, but in France, it's not the willingness. It's not what they were saying. We should prioritize homeless people, but in reality, it was not happening. Mm-hmm. And so, it's only recently that NGOs and organizations have been vaccinating homeless and migrants in the streets at a high speed.
Okay, we'll have to leave it there. Thomas Rohrer from Doctors Without Borders. Thank you very much for being on the show today.
Thank you very much. Have a good day.
Time to hand you over to DW's science correspondent Derek Williams with another viewer question.
If you catch the Delta variant, are the symptoms different? Information on the Delta variant is at times confusing, with different studies on how it compares to earlier versions of the virus regularly reporting contradictory results. But hey, that's just how science works. Consensus building takes time. What pretty much everyone agrees on so far is that the Delta variant is a lot more transmissible than the ancestral form of the virus. People who get it are almost twice as contagious. One preprint study indicates that could be because patients who contract Delta, that they might also be producing a lot more of the virus and a lot faster than earlier variants. The question of whether Delta causes different symptoms in patients, however, and in particular, whether it causes more severe disease, that's still kind of open. To try to answer it, a lot of researchers have looked at data from Britain, where the Delta variant has really dominated the COVID landscape for some time now. One wide-scale app-based study there that over time has tracked symptoms reported by British patients, it indicates that they might indeed be somewhat different for Delta on average. Participant responses there changed with the advent of Delta, and now they're reporting a lot more cold-like symptoms, such as sore throat or runny nose. Symptoms like dry cough and losing your sense of smell, on the other hand, which are commonly caused by other variants, those are now being reported a lot less often on the app. Other studies have linked the Delta variant to other more severe symptoms and increased rates of hospitalization, but the jury is still out on that.
Thanks for watching.